Hi, thanks for joining us. We're here with Mr. Marcel Ivanov, who's a consultant neurosurgeon who specialises in spinal surgery. And he's been trained in neurosurgery in the UK for about 12 years now, and his training has taken him to some of the best neurosurgical units in the UK, but also he's gone around the world to some of the places in Europe like Germany, as well as in North America. And for the last 3 years he's been working as a consultant in neurosurgery at the Royal Hallamshire Hospital, which is one of the Sheffield teaching hospitals. So he's going to talk to us today about back pain, because he's obviously he knows a lot about back pain. So thanks for meeting us, Marcel. How are you?
Thank you very much, Nadine. Thank you very much for this great invitation. I'm very well, thank you.
Good, right. So Marcel, a lot of us have back pain. I know I've had back pain in the past. What kind of things cause back pain?
Yes, Nadine, back pain is extremely common, as you said. We all know that probably 80% of the population will experience at least once in the lifetime back pain and probably some degree of leg pain. So the most commonest causes of the back pain and leg pain are degenerative changes in the spine, which because of the progression, because of the age, the discs which are joining the vertebrae together, they're getting dehydrated, they lose the elasticity, and the population tend to get overweighted, which will overload the spine, which is at the end is leading to the progression and development of the symptoms as back pain and very often leg pain, sciatica, pins and needles, and numbness in the leg.
So if we do get back pain, what sort of things could we do?
Nalin, we know that back pain is extremely common. But one thing is very clear: 90% of people will have improvement of the back pain in about 12 weeks from the onset of the back pain or leg pain. And there are different ways to help it. Usually the first line of treatment is just some regular painkillers, and your GP will be able to advise you which painkillers are more appropriate. It is important to have some physiotherapy exercises. It will help you to improve the back pain, and 9 out of 10 people will have significant improvement of the symptoms, as I said, in about 2-3 months from the onset of the back pain, which is great.
Okay, so we should just go to our GP and try some medicines and try some physio, and once we've tried all those things and we've tried to look after our back, if that still doesn't work, what should we do then? Is that when a surgery might be the option?
Yes, surgery sometimes is a very good option, and it is important to know when this is appropriate and when it is indicated. So if in 8, 10, 12 weeks time the back pain and leg pain hasn't improved, if you feel that the leg pain is excruciating, debilitating, disabling, if it stops you from doing your normal activity, if you can't do your normal walk, then this may be the good time to go and see a surgeon.
Right, okay, so if I've had pain for 3 months and it's really bad, it's going down my legs, and I've tried the medicines, tried the physio, and I've still got pain, how would I find the right surgeon? How would I know how to do that?
Finding the right surgeon is extremely important, and you need to do your homework to make some research and see who would be the best person to help you with the symptoms you have. First thing which I would suggest is to speak to other patients who had some previous problems and who underwent surgery, and get the feedback from this patient about their experience of dealing with this particular surgeon. But there are some other things which you want to know about the surgeon. One is his expertise, his experience. You want to make sure that your surgeon is dealing with problems that you have routinely. He is dealing with these problems both in the NHS and probably in the private hospital. You want to make sure that he is able to do not just a simple surgery, but also that he is exposed to a wide range of spinal pathologies, including with the complex spinal problems. We know that in most of the cases it will be a problem which is easy to resolve with surgery, but sometimes you may have a much more complex problem which should be and may require a major surgery, and you want to make sure that your surgeon is comfortable with this kind of procedure. also it is important to know that he is able to deal with different techniques, different surgical techniques. Sometimes you may need just a simple spinal injections, which may help to improve your back pain or leg pain, and it will be enough. You will be happy, the surgeon will be happy. Sometimes you may require just a minimally invasive spinal decompression, which will have usually very small risk of having a problem, and in most of the cases it will give you a significant relief of your leg pain, sciatica. But sometimes you may need a major surgery with instrumented fusion, which is a high-risk procedure, and you want to make sure that your surgeon has the best results in this procedure.
Right, okay. And so if someone wanted to come to you to try and get some help from you, what kind of experience would you be able to give them?
If somebody contacts me, approaches me, usually I will see them in my clinic, and normally I will see them within probably 2-3 weeks from the date of referral. We will have half an hour to discuss about the symptoms you have. We will discuss about your pain, how all this problem started. I will do some clinical tests. You may have already some examination, some imaging available. We will review this imaging together. But very often I will need some additional imaging. You may require an MRI scan of the spine, and I will usually organize this for you. We have a very experienced team of neuroradiologists who are reviewing these scans, and I have a very strong professional relationship with this neuroradiologist. We have a up-to-date, top-of-the-range MRI scanner, and usually you will have the scans fairly soon, normally within the first week from the date of referral. Then after we have all the imaging available, I will see you again, and we will discuss about what can be done about this problem that you have. If I can resolve the problem surgically, we will discuss about the surgical options. It could be a minimally invasive spinal surgery. It could be a much more complex spinal instrumented fusion. We will discuss about the benefits and risks of each option, and we will choose which one is more appropriate for you. Usually, after we decide that you may need this surgery, I will give you the date of surgery, which is normally within 6-8 weeks from the clinical appointment. You will be seen before the surgery by the anesthetist, by the pre-assessment team. They will make sure that you are fit for surgery. They may do some additional tests to make sure that you can cope with the surgery. And after this, you will come in the morning of the surgery. We'll have another discussion with you about what we are planning to do. After the surgery, you will be seen by the physiotherapy team. You will go home, and then I'll see you again for a follow-up appointment.
Oh, so you carry on following them up afterwards as well, just to make sure that everything is fine?
Absolutely. This is extremely important to make sure that you are well after the surgery. I will let you go back to GP only when I'm sure that I've done everything I could do from surgical point of view to improve your symptoms. Sometimes you may need a referral to a different specialist, and I will normally organize this for you.
Right, well that sounds really comprehensive and very caring. So if someone actually wanted to get in touch with you, Mr. Ivanov, what would be the best way of doing that?
I think there are a few options. One of the options is just to get in touch with the private appointment teams in the private hospital, but the easiest option is to get in touch with my secretary. The phone number is 0742 63 00077. And she will normally help you to make the arrangement. She will make an appointment for you. She will get in touch back to you to give you the details about the appointment, and will give you the advice what you should bring for the clinical appointment.
Okay, it's been really interesting talking to you, Mr. Ivanov. Thank you for your time.
Thank you very much.